Hi, everyone. Looks like we're right at about 1 o'clock. Hope everyone is having a good day so far. Thank you so much for joining us today. This is Revel's webinar, 3 Things Healthcare Organizations Should Know About COVID-19 Communications Using Behavioral Research. I'm Louise Bergoglio. I'm the SVP of Product and Development here at Revel, and I will be moderating the discussion today. And like I said, we're so glad that you're taking time out of your day to join us from your homes and offices or wherever you may be socially isolating and distancing yourself today. Like a lot of you, you can see that we're working from home and we know what working from home is like. Just want to acknowledge there's a good chance at some point you'll hear my dog in the background. You might hear someone else's child in the background. We'll do our best to mute ourselves so it's not distracting, but also just appreciate your patience during this unprecedented time for all of us. Real quickly, so I think people who know Revel well, and we know some of you are new to Revel, but you know that our product and design teams spend a lot of time out in the field conducting consumer research. So our teams go out into people's homes, they learn about their families, they learn about their beliefs, all in the name of understanding how people make decisions, and more importantly, how and why they take health actions and why they don't. So today, our webinar will focus on some of those behavioral learnings that we have and things that we are learning and hearing about the pandemic. Really, we want to do everything we can to help you out, to help make your own communications better, because the devil is often in the details when it comes to this kind of communication. We're truly in uncharted territory here. So we also look forward to hearing your ideas about what's working for you, and we will be sure to make some time for Q&A at the end of the session. But now on to the important people. So joining me today, we have Matt Swanson, who is our Director of Product Design, and also Sarah Ratner, who is SVP of Government Programs and Strategic Initiatives. Before we get started, just a couple of quick notes about how this will work. If you would like to ask a question, please do so. There's a Q&A feature here in Zoom, so you can go ahead into the Q&A feature and put your question in. We'll keep an eye on those questions as they're coming in, and we will reserve time at the end to answer those questions. We're also recording today's session, and we will be sharing that to you at the end of the webinar, so you can get access to it after we wrap up. Lastly, we'll also have a survey at the end of the webinar. So we have a few questions for you, and we're really looking for feedback on whether this was helpful and whether there's anything else we can do to help you out. So with that, let's go ahead and get started. Matt, I know that I bounce back and forth in my own thinking when it comes to communicating about coronavirus. Sometimes it feels like people know everything there is to know. In fact, the problem is that they're oversaturated with information about what they need to do. And then sometimes I think we get questions and concerns that people may not actually have the right information. So I'm curious, also there's just a brief look at folks' faces. I'm curious from your perspective, from the conversations you've been having, what are you hearing? Do people know what they need to know? Or is there a lot of misinformation that needs to be cleared up?
Yeah, so I heard something recently from an EMT that I really liked, which was they have a philosophy that they use where in times of crisis, people don't rise to the occasion, they fall to their level of training. So remember your training. And so we're going to start with the basics here, which is to remember that you're not your audience. I feel like what I find is that people who work in healthcare have a bunch of built-in institutional knowledge about what a pandemic is, how it works, how viruses work, how different institutions respond, and what roles they have to play. And that's not nearly as much the case in the general population. So when we have been talking to people, and things have been changing very quickly, but we've been maybe not going into people's homes, but having phone conversations and talking to them however we can, wherever they are. What we've done is ask people what their experience of this crisis is, where they're getting information, how they're using it, how they're preparing or not preparing, and what they think the impact on their health is. And we see a huge mix of good and bad information and broad sets of perception on how serious or severe this crisis really is. So here's a few quotes. You see people in the high risk zone or in the high risk age groups, in the 72-year-old in Florida, for example, who didn't believe that the pandemic was severe or would be an ongoing crisis as little as a couple weeks ago. We even heard some people talk about how if you could hold your breath for more than 10 seconds, you were probably all right. So the 57-year-old in Michigan who wasn't super concerned about her husband's situation because of this piece of information that she had heard. So we do see people with a lot of information that are doing just fine, but there is a ton of misinformation out there right now, and it's kind of pouring in from all directions. And what's really interesting about this situation, so normally I feel like I have two messages for our clients. Information doesn't affect behavior, and people don't trust health insurers with their care. And these are not normal times. So health insurers are actually relatively trusted now and have a huge opportunity, if they respond well, to have a seat at the table and earn some long-term trust from their consumers. So we came across this McKinsey study, and you can see here that health insurers people say that they trust the information from their health insurer almost as much as their doctor, which for me and my background and the kind of work that I do, talking to people about their care, their health, and who plays a role in that, this is astounding. This is really, really wild to me. This is a total flip from everything that I hear from people, which is that health insurers usually are not only not trustworthy, but often a nefarious actor in their health. We also see that only about 8% of people are actually getting the media from their health insurer. So it feels like there's a lot better opportunity for insurers to start to play a big role here. And the other thing I'll say real quickly is just that the first information that people get, especially in this situation, is really important because it becomes their anchor. And people are actually looking for information now because it's such a time of uncertainty and fear, and they're asking questions. And when people are asking questions, that's a time when information becomes really important.
Yeah, Matt, I think it's really striking looking at this. You know, you can see that health insurer is one of the most trusted, but also one of the least referenced, options here.
Yeah, I mean, it's at least reassuring that social media only hits a 5.6 on that scale, but that there are 34% of that information is a little concerning.
Yeah. So how are you thinking about, and how are folks that you're talking to, whether they're insurers or other health institutions, how are they thinking about getting information out to their members and consumers?
Yeah, so we do have a couple of basic recommendations on what to do here. Just some quick guidelines on how to think about this stuff. So first of all, we know from working in healthcare, from focusing entirely on communications in healthcare as a business, how hard it is to get communications approved. I'm sure you have an approval process that's extremely lengthy and hard to get through, and often hard to get really meaningful information through. You have to really craft that language. So because of those timelines, what my team has started focusing on is using that outreach to provide evergreen information, because you just don't know what's going to change over say you get a really abbreviated approval cycle over the week that it would take to get that approved. So find something that's going to stay evergreen. Sometimes the big five things that people have to do, like washing their hands and sneezing into their elbow, basic things like that we know aren't going to change. And in that piece of communication, give members or patients a path back to a place where information can be kept a lot more current. We show a screenshot of something that Blue Cross Blue Shield of Illinois and other Blue Cross plans have put up as a method of doing this that we think is pretty effective. It's a little bit easier to push updates here and keep information that's more relevant and up to date. So that could be a website, could be a call center. We've even seen something as basic as a voice recording that you update when you have new pieces of information. So there's a lot of ways that you can do this, and we would recommend doing it multi-channel if possible. I'd also say keep that outreach regular, so that you can kind of start to build that trust that something is coming in at a regular pace, as long as you're able to provide a little bit of incremental value every time you outreach. And multi-channel. One thing that we've seen is one of our clients, for example, had, I don't know, roughly of a particular plan, about a quarter of them had an email, and an email was the only thing they'd been able to get out so far. And so we're going ahead and doing a bunch of voice outreach on their behalf, calls to their members, as a way to help get that other 3/4 of the population, because you're just not going to have all their contact information. The last thing is that we've started doing this a little bit internally, and we would highly advise plans to also start thinking ahead, because we know what the arc of a pandemic looks like. We know it's going to end eventually. We know there's going to be a peak in the middle, and we know some of the activities that people are going to have to be thinking about along those times. Like when is it safe to start going back to your doctor? How do you start ramping up your telemedicine outreach? How do you start ramping up outreach on resources for people to get care in lieu of being able to see their physician regularly?
That's really good advice. I'm curious, Sarah, from your perspective, I know you've been over the last weeks having just tons and tons of conversations with plans and even states. What are some of the things that you think people should be thinking about communicating during peak, but also during recovery? And what are some of the things that you're hearing as you're talking to folks?
So there's a lot that has come out recently about what health plans can do. Many of you know that CMS released a bunch of guidance last week on the impact of COVID-19 relative to the plans, reporting, and star ratings. In addition, yesterday came out with the rate announcement and the interim final rule. And what we're seeing from that is that CMS is really responding to the needs and the behavior change that's happening in the market. So for example, they have blown out telemedicine, which is causing people to be able to access services that they otherwise would not because of fear of going to the doctor or the emergency room. Other things like allowing people to refill their medication before it's actually due. These are enabling people to maintain consistency with their healthcare engagement and adherence. Also, interesting enough, I'm starting to see with the number of people that are unemployed, I think it's above 10 million. What the government said is they're expecting about 95 million people to be on Medicaid. And so health plans are beginning to divert resources in the Medicaid space to helping those individuals find unemployment or gain access to unemployment resources. We know that that is a huge barrier for people. And so health plans recognize that financial stability is a social determinant of health. And so providing access to those resources is absolutely critical. So the market is changing rapidly. It's changing in response to the conditions, in response to people's behavior, as well as a response to the expansion of what plans are now enabled to do.
That's really helpful information. Thank you for that. Lots of good information there on what to think about communicating. Matt, back to you to talk a little bit more about how to communicate it, and in particular, whom to communicate with. I'm curious if there's anything you were hearing as you were talking to people that would point to who do we need to be reaching to really kind of change behaviors and bend the curve on the pandemic? Do we do the usual thing where we really think about sort of targeting those who are most at risk? How are you thinking about audience, and what are you learning is important in terms of audience?
Yeah, real quick before I do that, I saw that Peter posted a quick question. What is evergreen information? I just want to address that really quickly. All we mean is that evergreen information means information that's not going to go out of date. So things like washing your hands is going to help stop the spread of the virus. We know that's not going to change, but the particular details behind a benefit change, for example, maybe would be a little that could change in the coming weeks. That might not be something you want to include in the outreach. But you could say go here for information on your updated benefits, for example. Hopefully that helps clarify that, Peter. Thanks for the question. Now, for the audience, in my experience, insurance companies are extremely good at stratifying their population, finally targeting the most high-risk groups, and I'd strongly encourage not taking a very precise route on targeting for this. And I'd say that that's because there are two patterns we're seeing: an accelerated caregiving role reversal between parents and children, and younger, say, what we would call more high information, internet savvy folks still being really uninformed. So we think that broadening your targets to include younger and healthier members is the right way to do this. So for the first point, the caregiving role reversal, especially among boomer population parents and their children, is happening at a much more accelerated rate right now from what we're seeing. And it's so prevalent, you're seeing it actually bubble up into popular media. We heard from some older parents shocked that these recommendations are about them. I heard from one person who said that she was talking to a group of her friends and said, who knew that we were the old people that these recommendations are targeted at. I also spoke to someone who turned 65 in February, and she kept stressing how she felt like the recommendations didn't really apply to her because she had just turned 65. So she wasn't really 65 yet. But what we're seeing is a lot of these people are getting either pressure or information or guidance from, or sometimes even shame from their kids who are either more informed, more plugged in, more passionate about these things. We spoke to someone, a 60-year-old in Arkansas, who described that, she said, the old folks around here are getting information from Facebook and their kids. So we see younger folks being a good target for information because often they're a channel to the people that you're really trying to target and you're really trying to help and prevent from being exposed to risk here. Does that kind of make sense?
It does. Yeah, that makes a lot of sense.
Yeah, well, and on the flip side, we also see younger people being really uninformed about this. We've spoken to some younger people who are closer in the Gen Z area who were thinking this was extremely over-exaggerated. We all saw news reports of the spring breakers in Florida, which I think most of us on this call would agree was pretty irresponsible. So uninformed younger generations can be a big problem for two reasons. They make the risk worse for all of us, especially the most vulnerable. I think we all know that. And they really influence how higher risk people can behave. And at the end of the day, the way to change behavior is understanding those channels of information and how these relationships are working. So being able to impact a broader set of people, we really think is gonna be a big help here.
That's great. Keeping an eye on time, I know another topic that we wanted to cover today is, again, we talked about the sort of the devil being in the details often when it comes to influencing people. And I know that's something that you think a lot about is what's going on with people emotionally. You know, what are their beliefs? You know, thinking about the fact that people are fearful right now. So just wondering if you have any advice on tone. And what's the best way to make sure the message is effective and gets through to people?
Yeah, so this is also a place where I think what you're hearing through this is that everything is kind of flipped on its head right now. So because there's so much uncertainty and fear, normally what we would talk about is how we want to be really consumer friendly, how we want to fit into the wellness ecosystem, how we want to be associated with being a partner for people. And they're not actually looking for that anymore. In times of uncertainty and fear, people are looking for more of a paternalistic leadership sort of tone. Someone that says, this is how things are going to go, and here's how it's going to work. And this is really interesting because it lines up really well with some past research that we've done into how people think about chronic condition management differently from acute care, where you see people with chronic conditions or often undiagnosed conditions, as with Bernadette here, really looking out for that partnership and really hoping that, that health institutions can be that partner and be that equal and work on the equal playing field. So she was trying to get a diagnosis for a condition she couldn't quite figure out, and went so far as to fill out forms ahead of time to send to a doctor in hopes of having a really productive conversation so she could decide if this doctor was actually going to be the right fit for her. On the flip side, when someone's in a really acute situation, when they're afraid, when they're entering something unknown, when things are being kind of forced upon them and they haven't had time to process and work through it, they're really looking for someone to tell them exactly how it's going to go and what they need to do, what's going to happen, and how all this is going to work. As with Emily, who blew out her knee playing soccer and had to have full reconstructive surgery. And the way that these voices have gone for us, what we've seen is that that payers, that health insurance companies tend to push more on the consumer-friendly side on the left over here, where what we see when we do an analysis of provider communication is that it's a little bit more paternalistic and assumes a lot more opt-in. So we've kind of defined these as payer and provider voice, and actually run some tests across I think our test group was something like 700,000 individuals to see when we discuss care, what kind of voice and imagery and treatment really works better. And what we find is that, that when we're talking about care, especially in times like these, the provider voice is going to be a lot more useful. So rather than being friendly and empowering and saying something like, share your voice so we can understand what coverage to provide, for example, a call to action for a health risk assessment, which is super topical given the times, you might say, you might assume opt-in and be more direct about this being about care and say something like, it's time to complete your health assessment so that we can evaluate your care. And we found, based on our testing pre-COVID-19, that this provider voice is actually going to give you a significant lift.
This is really interesting. It's interesting for a couple of reasons. One is I hear you sort of saying that what we're in right now feels a bit more like an acute condition, to your point, like when somebody has a traumatic injury and they need care and they're really looking for that leadership. It's also interesting because in so many ways it seems so contrary to everything that has certainly been taught to me about the need to consumerize healthcare. I think sometimes we index on sort of being friendly. And so it's interesting to know that at certain moments, indexing on being a leader and speaking with a bit of authority can actually be more effective. So that's really interesting and
yeah.
Makes a lot of things that I thought previously.
Absolutely. I feel like I've completely flipped all of my going in assumptions into what to do in the last month.
Yeah. Well, this was a brief webinar, and we definitely want to take some time to get to Q&A. But before we do, Sarah, I wanted to ask you, is there anything else you would like to share with folks who are listening today about how they can apply this information to their communications, or anything else that you think people should be thinking about during this time?
Yeah, so similar to what Matt was speaking about, we're in a very odd time where we've got a convergence of terrible financial issues and a massive healthcare pandemic. And so just reiterating that voice of authority, but the voice of authority with a sentiment of caring and kindness, recognizing what people are struggling with on so many different fronts, especially around the loneliness and social isolation. So there's a sensitivity that also needs to be applied around how people are communicating, a sensitivity more than ever because we're all suffering in some way, shape, or form.
Couldn't agree more. So what I'm going to do here, thank you, both of you, for all of those great points. I'm going to stop my sharing and take a look at the Q&A panel here. Great time to submit your questions if you haven't yet. Matt, looks like there is actually one for you. I know you touched on this briefly. So on the one hand, you talked about the importance of evergreen information, things that don't change and making sure that shows up in communication. But what about the flip side? It feels like information is changing so rapidly and that really, really needs to be communicated as well. Can you talk just a little bit more about the methods that people should be using to stay on top of things when it's changing so quickly?
Yeah, there's a couple of things that we see that organizations are doing well. One is providing that one centralized place to go to, whether that's a call center, a website, even a voice recording, something basic is totally fine. And I would say, at least on web, another thing that we've seen is providing live changes, maybe not live changes, but documenting those changes. And for each section where you might have how benefits are changing, how the pandemic is changing, how information is changing, you can kind of imagine, one thing that we've seen is the way that say political events are live cast, how there is a record of what's happened and what you've published as you've gone along. So you can have the most up-to-date information at the top along with time-stamped older information, and that can be really effective as well.
Another great question actually just popped in, and actually, Sarah, I'll send this to you first, and then Matt, I'd actually like to hear your take on this as well. I think you'll both have slightly different perspectives, which is from Alex. So are there any particular considerations for outreach to marginalized health populations? They may have different relationships with healthcare and have been treated very different by healthcare. So Sarah, what do people need to be thinking about that? And then Matt, over to you afterwards.
Yeah, so we did a podcast on this a couple weeks ago, and it related to social determinants of health during the COVID-19 pandemic. And what we really spoke about is how don't underestimate the diversity and communication that is needed today. Not everybody watches TV or the news. Not everybody is getting text messages. A lot of people still rely on picking up the phone or their mail. So that diversity and really understanding the population is absolutely critical. Also, factoring into that is the use of technology. We are all very fortunate to have that and to be on Zoom and working remotely. Don't underestimate that we are going to have to be flexible around technology and become more adaptable to traditional ways, because people who may have access through their work, who are either unemployed, laid off, or just don't have access at home, we need to be able to understand that population and flex to them for their particular situation.
And Matt, what's your take on that question?
Yeah, so maybe I overstated the paternalistic tone a little bit. Yeah, because I definitely don't mean to overstep that. It's a subtle thing. I think what I would recommend to organizations who would like to understand how to do this well is to, one quick way that you could do this, and this is a method that we use to get some early findings and some early steps into this space that we think would not, that we have evidence to say that is not going to negatively impact your relationship or even ability to reach marginalized populations who have been historically mistreated by the healthcare institutions, is to look to how providers provide this information. So it's not a command. It's not a saying you must do this and I'm the one who is right. It's really a subtle treatment. So it's toning down imagery. It's assuming opt-in, saying things like it's time to, and having more clinical citation available inside of the communications that you're offering, which again is a flip. It's a subtle flip, but in my world where I'm focusing on that every single day, that's why it felt so dramatic of a swing to me.
Good clarification. So we are out of time, unfortunately. That went much faster than I even expected. So if you asked a question and we weren't able to get to it, we will send it to Sarah and Matt and give you a follow-up response. Also want to just remind folks, we will be sending out a survey. Really appreciate if you can take a second to give us feedback. And then lastly, this was recorded. So the recording will be available, and we will also be including some resources that we have found really interesting around communication, what's going on with consumers, and we will share those with you as well. Stay tuned. So Revel will have more information on these topics. Also look forward to learning from you all about what's working for you and what you're trying. Thank you so much for joining us today.